I think we're about to go live now. So good afternoon, everybody. My name's Liz Ball, and I'm a trustee director for HW Links, which is a charity that hosts the Healthwatch contract. So really thank you all for joining us this afternoon, evening, and we're here to discuss the new contract for the non-emergency patient transport. What I will do is introduce you to the panel that you can see in front of you, and then I'll just describe a little bit about the plan for this event, and then I'll pass you over to Tim Fowler, who's our Director of Commissioning, who's going to talk a little bit more about the contract, and then we'll go from there. So without further ado, can I introduce you to Tim?
Hello. My name's Tim Fowler, and I work for Lincolnshire CCG, and I have the responsibility for the patient transport contract with the CCG.
Thank you, Tim. Can we go to Pauline next?
Hi, I'm Pauline Mountain. I'm also a non-exec director on HW Links and also responsible for the Healthwatch contract as vice chair at HSG. Thank you.
Thank you, Paul. Thank you, Pauline. If we can go to Kevin next.
Hi, I'm Kevin Gibson. I'm the communication and engagement lead for Lincolnshire CCG. Supporting Tim with the work that's happening around the non-emergency patient transport service to ensure that the views of patients are considered when we draw up the specification for the service.
Thanks very much, Kev. So that's the introductions of the panel. What we've had questions from a number of yourselves, which I will go through and refer to the panel members. The questions I won't read verbatim on all accounts. Some I will, some I've tried to summarise so we can get the best out of this session. If anybody feels that their question isn't answered fully and has still got concerns about that question, we will refer that question back to the clinical commissioning group and get you an answer to that question. In addition, as with Zoom, we're all getting used to Zoom. I was on a YouTube video this morning trying to get a little bit more used to Zoom. And there is the chat bar, so you can actually raise the question in the chat bar, and we'll come to those after the questions that we've already had submitted. We are aiming to finish at 5 o'clock because some colleagues have got other meetings and responsibilities to go to. So we'll try and sum up just before then and share with you the next steps. But please be assured that the information and the questions that you're sending in, either sent in to us today or are submitting, are really valuable contributions that will help shape the new service for the non-emergency patient transport. So without further ado, I'll pass you over to Tim, who'll say a little bit more about the new contract, and then we'll start going through the questions. So over to you, Tim. Thank you.
Thank you, Liz, and I just want to reiterate thank you for everybody for sending in questions and for participating this afternoon. We're really keen to get views from patients, from the public, as we start to think about the new service that we will put in place for patient transport in Lincolnshire. The current service has been in place since the 1st of July 2017. We went out as a 5-year contract, so that ends on the 30th of June 22. And as is usual in the NHS, when we know that a contract or a service is coming to an end, we start to do some work on how that contract will be reshaped, how that service will be reshaped, learning the lessons from the contract that we've had in place and the service that we've had in place, and hopefully ending up with a better service that meets the needs of patients in Lincolnshire better. We know that things are going to change over the next few years. We've got some uncertainty regarding how we respond to the recovery from COVID. And I think we all know that COVID has been quite an issue as we've gone through certainly the last 2 years. And that's affected some of our responsiveness and how some of the patient transport has worked. What we also know is that there is a national review of patient transport that was launched in November 2019. It was expected to report in November 2020. It hasn't done that yet. We hope it will report within in the next couple of months. We know some of the themes that have come out of that review, and as we start to shape the new service, we will actually think about how we take account of that review and make sure that whatever provider is in place from the 1st of July 22, they are able to make sure that they deliver to what has come out of that review. So just to give a bit of background, I've been involved in this contract from probably the 3rd of July 2017. I think we all know that there have been, certainly in the first couple of years, there were a number of issues with the contract. We regularly review the delivery of the contract with the current provider. And we do want to make sure that whichever provider we have coming in the new contract, that provider provides a really strong, really robust service for Lincolnshire, and also takes account of the rurality of Lincolnshire. So Lincolnshire has only got 19 miles of dual carriageway. The travel times in Lincolnshire are really difficult. We know that it's tricky on the East Coast to get to a hospital. Through COVID, we've supported online services, but that's not to say that patients shouldn't get to hospital and shouldn't have transport to support them get to hospital. Obviously, they should. So we do understand the trickiness of running this service within Lincolnshire, and we need to make sure that that's correct for when we have this new contract in place. Shall I leave it there for now? And I'm happy to take conversations and questions.
Thanks, Tim. And I think some of the questions that we've had in are around some of the current challenges, and specifically a number of people that are probably have joined this afternoon's session are raising concerns about waiting to be picked up. So we've got a question in around patients are waiting at the moment after an appointment, and I guess the question there is, how is that going to be addressed within the new contract?
So we know that there have been lots of issues with patients waiting too long to be picked up, both to get to hospital, but more importantly, when they're coming out of hospital. And that works in two ways. One of those ways is where patients are waiting for transport when they've been discharged from hospital. The other is where patients have had an outpatient appointment and they've had to wait long times for outpatient appointment pick up to get them back home. I have had quite a lot of dealings with United Lincolnshire hospitals. I've been up to both Lincoln County and to Boston. And I've experienced for myself some of those waits, and it's not good, it's not acceptable. So in the new contract, what we're trying to do is make sure that that's addressed. We, through the specification, are building in requirements for the provider to make sure that patients are picked up in a timely manner. I can't promise that for every single patient, every single time, that will be as quick as the patient wants, but we want to make sure that the provider works really closely with the hospital, works really closely with the clinics and the discharge teams at the hospital, so that we've got a line of sight, the provider has a line of sight to when patients are ready to go home. Inevitably, within a resource that is limited, and it always will be, some patients will have to wait a little while so that we can get the right number of patients on vehicles. So that will happen, and that may mean that patients have to wait a couple of hours. What I'd be really interested in, though, is a view from patients and from people who've experienced delays about what they feel an acceptable length of delay is. So for me, I've been at the hospitals and I've experienced patients who've waited 4 hours. That's not acceptable. That's not right. But what we can't do with a service such as this is guarantee that every patient will be able to be picked up within 10 minutes of the end of their clinic session or the end of their appointment. Some patients will have to wait a bit longer so that we can maximise the capacity on the vehicles. So I'd be really interested to know through the chat or through comments what patients think would be an optimum time. My personal view is 2 hours is probably about right, probably about the maximum. But again, I say I'd really welcome views on that.
Yeah, I think, Tim, it's a useful question to ask, isn't it, in terms of how long are people prepared to wait? But I have had a question in from another member of the public around that their pickup time was so delayed that then when they got to the hospital, their appointment was cancelled. So whilst I can appreciate there might be some delay after an appointment, it's the before the appointment as well. So how can we give some reassurance in the new contract that that will be addressed also?
So again, what we want to do is get the transport provider to work in partnership with the hospital. Sometimes we will get unavoidable delays, but most of the time those delays shouldn't happen. So the pickup time where a patient is picked up very late and because of that they cancel their appointment or the hospital cancels the appointment, that's just not good enough. So we want the provider to work with the hospital. We want the provider to build more resilience into the vehicle journeys. We are thinking about separating the call handling. So when you ring to make the appointment, we're separating that from the journey delivery. What we also want to do is increase the use of taxis. So we find sometimes that the large vehicles that travel around Lincolnshire, they are constrained significantly. Now, some of those vehicles are necessary to transport patients who have, for example, limited mobility, so where patients are on a wheelchair or where patients need a stretcher. It's unusual for patients attending appointments for diagnostic or outpatients if they're on a stretcher. It does happen. But we think there's a way of improving that service by increasing the use of taxis and by separating the call handling so that when you have a problem, you can ring the patient call service and they will sort out the problem there and then. So we want to improve both for the hospital and for patients the communication, and communication is really key. There's been lots of examples that we've had where the provider hasn't communicated with the patient. They've left them hanging, not knowing when transport is going to turn up. And again, we want to improve that massively within the contract, and we've written that into the specification. When we start to evaluate the bids that come back, this is a bidding process for providers. One of the criteria we've got is around how they will communicate with patients and how they will improve that. We've also got questions in the criteria about how will the provider make sure that they pick up patients on time, whether that's going into hospital or whether that's coming out of hospital. So we're very conscious that we have to improve that.
Thanks, Tim. Again, sort of on a similar theme, I will move off the weights shortly because there are a lot of other questions, but it's come up in the chat as well, and I just saw a poll that's come up in the chat. I think, have people got an opportunity to vote there? I think that might be what's gone in the chat in terms of what delays, so if people can complete that. But specifically we've got delays from over border as well, so I think we'd had one from in the questions, one from Peterborough in the south of the county, and I see somebody's put in the chat about that about the south, but also Nottingham as well. So there's kind of people being almost left stranded in locations outside.
That just shouldn't happen. So where it does, I can only apologise if it's happened to patients. It shouldn't happen. We will build into the new contract an absolute, not guarantee, but a surety that patients and the patient provider really concentrates on the out of area patients. We know we've had some issues at Queen Elizabeth Hospital in King's Lynn recently. Again, that's not what we want to do. That's not where it should be. So we have got in the specifications a requirement for the provider to think really carefully and to make sure they deliver that out of area service. So Nottingham, Leicester, Northern Lincolnshire and Goole and Grimsby and Scunthorpe, Hull, Sheffield. So they need to make sure they have a service there. One of the things we're talking to providers about is if they can't take the resource out of Lincolnshire, how might they tap into the resource that's associated with those hospitals? So the vehicles that are associated with those hospitals, maybe they are a way of bringing patients out. Again, we're thinking about using taxis more inventively. So not leaving patients stranded, but asking the provider to say, if there's a patient at Nottingham and they're 2 hours, 3 hours, 4 hours beyond their time, why can't you get a taxi? Now, taxis won't always be suitable, but for a number of patients, they will be. So it's looking at this on a multi-pronged approach, but making sure that the provider is really clear on their responsibilities, not only for patients who have treatment and access services within Lincolnshire, but for patients from Lincolnshire who access services outside of Lincolnshire.
Yeah, and in the chat, Tim, we've had notice from, I think, Tony about Grimsby, so that would be included. And yeah, then definitely. I think Clive had actually said, so who is the patient transport for? So is it for all Lincolnshire patients wherever they're going? How could you explain that to everyone? So
basically any patient who is registered with a GP practice within Lincolnshire and any patient who is resident in Lincolnshire but not registered with the practice. So basically the population of Lincolnshire, that is who we commission the patient transport service for. So if there's a patient from Lincolnshire who goes to Manchester, the patient transport service, if that patient is eligible, should take the patient to Manchester and bring the patient back from Manchester. If there's a patient who is on holiday in Lincolnshire, who is registered with a GP practice in Nottinghamshire, then they wouldn't qualify for patient transport from Lincolnshire. Nottinghamshire would work out their patient transport. Equally, if there's a Nottingham patient in a hospital in Lincolnshire, at Boston or at Lincoln County, this service doesn't provide a transport for a Nottingham patient who's in either of those hospitals.
Okay, thanks, Tim. That's really helpful. And just one final point on the weights, and this is coming from a staff member. So obviously we hear that we're trying to make the improvements around weights and trying to get there will be some weights on some occasions, but about that acceptability. But from a patient that's maybe going in for a short period of time, we've got an example that a patient might be going in for a blood test or maybe something that can't be done at the GP practice, which is going to be short and sweet, in and out. Yeah. There's kind of a view that the drivers don't currently wait. Is that something that's being considered or could be considered for those individuals that aren't going to be in, the hospital facilities for very long?
Yes, and again, this comes back to using taxis, perhaps. So one of the views coming out of what we understand from the national review is that we can use taxis, or taxis should be used, because that provides a lot of flexibility. So rather than using, say, the big vehicles, maybe we should use taxis for those short times in hospitals, because taxis generally will wait. Or they can go off and do another quick job while the patient is in the hospital. You don't get the same flexibility with the large vehicles.
Yeah. So I'm going to move on slightly.
And yes, we want a solution to it.
Yeah. So thanks for that. And it's really recognising those real rich comments, isn't it? Both from the people that are using this service and some staff as well to help make those improvements. So in terms of the criteria, we've got a few questions around that. So the first question that's come up is, I'm going to read this one. It's a short one. So is this transport free to all users, or do some people have to pay for it? So I guess it's a bit around who is this transport for as well.
So if I answer the question directly, the transport is free to anybody, provided they are eligible for patient transport. So nobody should have to pay for patient transport to a hospital or from a hospital if they meet the eligibility criteria. The eligibility criteria are quite old now. They were set originally back in about 2007, I think. And basically they say that if there is a medical need that you have that prevents you getting to the hospital under your own steam, then patient transport will be provided. The way that works in practice is that the patient transport provider will have a number of questions they'll ask the patient or the patient's relative at the time that the transport is being booked, and they will take somebody through those questions, all of which are designed to find out whether the patient has a medical need or not, and to establish whether the patient meets the eligibility criteria. So that's how it works. We expect that out of the national review, the eligibility criteria will change. Unfortunately, what we don't know is what it will change to. Now, there are two things there. One is that it could be loosened. The other is it could be tightened. So we just don't know at this point in time, and we're waiting to find out. But we will hold to whatever the national guidance says, which is what we try to do at the moment. So hopefully that answers the question.
Thanks, Tim. And then another question around the criteria. So obviously a lot of individuals may have carers, and the question is around, do you allow carers to join the patient being transported, as most services provide concessions for carers because they have to be present, and can we clarify that in our policy?
Yes, it should be relatively clear in the policy, and certainly pre-COVID it was. And that's that carers are allowed to travel with patients. There is a view that we would take that during COVID, it's not right for carers in all instances to travel with patients. And that's about risk of infection to staff and risk of infection to the carer and the patient. So we've tried to minimise that during COVID, and that may be where some of the confusion around this arises. But yes, carers are allowed to travel on vehicles. There's nothing to say that they shouldn't, and in fact, for a number of patients, it's absolutely essential that they do. So there's no restriction at the moment on carers travelling.
Okay.
It's just that during COVID, there's been some kind of encouragement not to have carers because of the infection risk.
Okay, thanks, Tim. I think we've got Pauline on our panel that I'd like to come in now.
Yeah, I would. Tim, I'd like you just to really confirm that in absolute detail, because carers tend to get a raw deal when it comes to saying the word carer. So and especially in this domain, because we have care workers, which are paid carers to look after the individual and get them on board wherever they go. So they're paid care workers, but we also have family carers, which are you and me, husband, wife, daughter, son, etc., etc. So I want you to be really clear and put, say it as it is. How is it?
So it is that. So there are two things that we look at. One is what we would call medical escorts. And that's where somebody who looks after a patient medically or clinically, so a care worker, for example, or a nurse, is required to travel with the patient. So they are carried on the vehicles. The other is where we have a member of the family who needs to travel to support the patient. Now, if the patient can make their own way and it's just a social view and somebody's just going along to just because the patient would like them to, rather than there is a need for support, then that's something that we wouldn't encourage. But where there is a need for support, absolutely, the carer, the family member, should be able to travel on the vehicle and should be able to travel to the hospital or from the hospital with the patient.
So, okay, that might be a bit.
Does that clarify it?
It does, and I'm sorry to sort of push you, but that might be a bit ambiguous to a carer. So if it's, you know, and if it's mental health, if it's anxiety, how do you qualify it? And you don't want to end up in sort of a catch-22.
And that's a conversation that the provider needs, the transport provider needs with the patient when the transport is booked.
So
I'm not going to sit here and legislate and say, here's a criteria for every single patient. I can't do that. Good. It's a conversation.
Great, thank you. No, that clarifies that for me. Thank you.
So, thanks for that. So I've just had popped up in front of me the voting. So I think we'll just share this with those that are on the call. So this was how long are you prepared to wait? So we've got 16% of you have said less than 30 minutes, so that was 3 people. 32% have said between 30 minutes and an hour, that's 6 people. And then we've got the majority, 53%, 10 people have said between 1 and 2 hours, and no people have said more than 2 hours, Tim. So that's perhaps a quick snapshot which would be really helpful for you.
That's really helpful to understand. So thank you for that, everybody that's responded.
That's great. So thanks for doing that. I think in the chat as well, we'd had something around the eligibility criteria, Tim. Is that publicly available? So can people go and look at that?
Yes, it should be. If you Google it, it should be there.
Okay, so try the old Google.
If not, I will, and I don't know, I'll talk to Kev whether it's on our website. I think it's on the CCG website. It should be. I will check on that, and I can send out the link to Healthwatch if that would help. Kev,
did you want to say anything on that?
Yeah, the criteria is on the CCG website. So I'll post a link to it in the chat.
Thank you for that, and thanks for that question. So people will be able to look, bearing in mind what Tim said, that the eligibility criteria is due to change. So we've got now. I'm going to move off on eligibility. We've got a couple of questions around planning. So we've got a question that's come in around health transport. It's been too long. You know, it was real emphasis on this long. Why is forward planning and communication and forward planning? Why is forward planning and communication with the forward planning? So it's kind of saying why are things still not happening? So I don't know if you want to answer that one for us, Tim.
I'll try. I'm not really sure I understand whether this is about the planning in terms of planning journeys, or whether this is about planning in terms of the overall service. So it's about planning in terms of how does a transport provider plan a journey for a patient. We know that in the early days, the current provider had a few issues with that, wasn't doing it in perhaps the best way. I think that's generally been resolved now, even though we've still got a number of issues where clearly patients are saying that they're not being picked up on time. Some of that is response to COVID, but I won't dwell on COVID. I'm not going to use COVID as an excuse throughout this webinar. That would be wrong to do that. If it's about planning the service, the service is basically recontracted every 5 years. What we're now looking for is a longer term partnership with the provider. And I think that's the right thing to do given the way the NHS is changing. If we have that longer term partnership, it means that we can respond, I think, to issues of delivery of the service where patients aren't being picked up. Any new kind of changes in guidance, we can respond to that far better. And we want that kind of relationship where the provider is seen not as a bolt-on and where patient transport is seen as a bolt-on, but where it's a key part of what we are trying to do in the health service within Lincolnshire. And I think far too long, patient transport has been a bit of an orphan service. We want to bring it in as a properly commissioned, proper service that works in partnership with not only the CCG, but with the hospitals, with the community services, with the voluntary sector, so that we get a really strong, really good service. In terms of the planning, yes, that's what we're doing at the moment. This webinar is part of the planning for the service that will be in place from 1st of July 22. And we genuinely do want views, and we want to respond to views of patients within that planning process. So I don't know if that answers the question. I'm a bit confused about what the question is actually getting at.
Yeah, I think you could perhaps interpret it two ways, but there is another question which is more specific. So it's saying, what timescales are we working to regarding the shaping of the new service, and what has been the feedback from the past webinars? So perhaps that is kind of saying what's the timescale now, Tim, for
okay, so
what are we working
what
to?
we would expect to do. So we're going out to a procurement. And we expect to launch that procurement within the next week or so. The feedback from this webinar will inform what we go out to that procurement with, so it will inform the specification. We've already got some feedback from the previous webinars that we had, which has informed what we've put in the specification, the draft specification. We've also had, I think, about 140, Kevin will give a better understanding of that, 140 surveys that have come back from patients. So we launched a survey to get patient views, and we've taken account of a number of those issues, the themes that have been raised from those surveys in what we want the new provider to provide, what we want them to do, and again, we've put that back into the specifications. So we genuinely do want to understand what the concerns of patients are, and where we can, we want to resolve those. Kev, was it about 140 responses we've had?
So we had 142 responses to the patient survey, and we also did a staff survey as well, which got an identical number of responses as well, and some really useful feedback, which we've managed to theme into communication and the way the service is communicated to patients, but also staff, the timeliness of the service, eligibility, the use of technology, the kind of retaining the importance of retaining the existing staff, because the majority of people who responded felt that they were very friendly and very caring. And there was one more as well, just bear with me a second. Around the process as well, and so for the process of booking transport, but also internally within health and care organisations, the kind of the process for communicating and dealing with the provider.
So all of those are themes that we are picking up in the specification and the conversations with the provider. The feedback from today and the comments that are made today will definitely go into the view on the specification. It doesn't end here. So any feedback that happens, even once we've pressed the button on the procurement, we can go out to the providers and we can use that for the dialogue with the providers of the transport service as they're going through the procurement. Once we've got a preferred provider, again, we want to talk to them. We want them to talk to patients as well. So it's not just about the CCG making the decisions, it's about the provider talking to patients, the provider talking to healthcare practitioners, the provider talking to the staff in the hospitals and the community services. They should be talking to patients and healthcare practitioners on a very, very, very regular basis and adjusting their service for the concerns that are raised.
Okay,
thanks.
Thanks.
Just be the CCG that does it.
Yeah, in the chat as well, we've got a comment around, are we getting sufficient planning for the needs, really? So it's saying is sufficient capacity planned in order to prioritize areas of high aged and ill populations on East Coast who are miles from nearest hospital. So is that all being taken into account in the planning for the service?
Yes, it is. We've looked at the journey times from the East Coast into the various hospitals that generally serve the East Coast. We know that we've got an ageing population on the East Coast. We know that we've got high areas of high deprivation on the East Coast, all of which we're bringing into the service specification and the dialogue with the new provider. There's something called social value, which is really key for us in Lincolnshire. And as part of social value, which again we've put into the process with the new providers, social value says that the providers got to gear their services around areas of deprivation, and the East Coast is a real key area of that for us. So yes, it is all being taken into account, and hopefully we'll get a good solution that allows patients on the East Coast to feel like they're being treated more equally than perhaps they have been in the past.
Thanks, Tim. We've had a couple of comments in the chat about the missed appointments. So if a patient does miss their appointment because of transport being late, then kind of what are the repercussions of that, really? Is there anything going in the contract regarding that? Because obviously that is very devastating for the patient, isn't it?
Yeah, absolutely. So the short answer is yes. I could go into the mechanism that we're thinking about for that. That probably will take some time. But what we're going to do is we want to link an element of the provider's income for them to provide a strong healthcare practitioner and patient satisfaction. So if they don't provide a good level of satisfaction for patients, and part of that will be, are you picking patients up on time or leaving patients stranded? If you don't do that, then there will be a financial penalty, or you won't earn the full value of your contract.
Okay, thanks Tim for coming back on that, because it would come up a couple of times in the chat, so I thought it was important just to raise it at that moment. We've now got a few questions about more general transport issues, not necessarily to do with the non-emergency transport, but obviously this is causing concerns for some of our public in Lincolnshire. So we've got one commenting about somebody leaving hospital late at night. They didn't have a car, there was no bus, and so they're kind of were either they were capable of walking their distance home, but what if people aren't? We've got another one, what are we doing about non-emergency for emergencies? And I think there was a third one is when patients have been taken to accident and emergency that might be outside of their location and public transport isn't reliable, especially at night, how are people going to get back home again? So a real kind of some about the vulnerable, but some about how we're going to get patients back home once they've been into the service.
Okay. So if I pick those in kind of reverse order, very conscious that where patients have access to an A&E department, A&E departments aren't just around the corner, but where they've been into an A&E department and the A&E department has said, yes, discharge late at night, and there is no bus or no transport. We come back to, unfortunately, whether the patient is eligible for patient transport services. We don't usually provide a service for patients who are not eligible for patient transport. So if somebody isn't eligible at that point in time, they would be out of the scope of the patient transport service, which is what we're talking about today. We then get into sometimes the hospital would provide a taxi for the patient. That's for the hospital to decide, not for the patient transport service that we're talking about today to provide. I think for me, if there is a patient who really can't get home, then it's right for the hospital to consider whether they would provide a taxi or whether they wouldn't. But that's not the scope of what we're talking about today. So I think it's a point well made. There are times when the hospital will provide a taxi. There are times when they won't. What shouldn't happen is if patients are eligible for patient transport, they shouldn't have to make their own way home at all. That should be provided.
Okay, thanks, Tim. I know it's probably not an easy question to answer in terms, but I think it's basically, I think what you're saying, on a case-by-case basis.
It is on a case-by-case basis.
Yeah.
And it's not for the CCG to decide. The CCG's responsibility is for patients who are eligible for patient transport. There is a piece of work ongoing where there is an acute services review that's been talked about within Lincolnshire, and there's been some engagement with patients on that historically. And we do know that how patients get from point A to point B, if services are not going to be local, is really uppermost in patients' minds. So some patients may not be eligible for patient transport, but they'll have a longer distance to travel. And we're working through that at the moment. I don't think there's an answer to that at the moment, but we're very, very, very conscious of that in the CCG. And we are thinking about potential solutions for that. Okay, thanks, Tim. So it's kind of probably more information will come on that in due course. Yeah, I've also had a couple of questions or comments around the current service provider that I think are probably more offline comments. So probably that's something we can provide responses to outside of here. But there are a few questions on the contract. So there's one question which is great, I think, is who's going to get the contract. So I don't think we know the answer to that one yet, do we? But yeah, I can't answer that. Preemptive question, isn't it? Yeah. We will go through a very thorough, very rigorous procurement process. We had a market engagement event, which is where we spoke to providers who'd expressed an interest in this. And I think there were about 17 or 18 providers who responded to say that they might be interested. Whether all of those providers submit a bid, a response to the tender documents we put out, I don't know. But we will go through a very thorough evaluation process. We will pick the best provider that we can. But we do want this partnership approach. So we do want to talk to the provider. We do want to say to them, these are the issues in Lincolnshire. Do you understand them? We want them to demonstrate that to us. So, we need to let that run its course. I can't, I'm not going to sit here and say it will be provider A or provider B. I just don't know at this point in time, nor would it be correct for me to say so. So we will go through the process. If, a provider is the best, they will get the contract. Yeah. Okay. Thanks, Tim. I'm conscious of time. We've got a little bit of time left, so I'll try and get to the chat. There was a question around will it be possible to have a voluntary driving service in the near future? So how voluntary drivers linked into the service? So we would want the provider to work with the voluntary driver service. There has been historically a really strong voluntary car service within Lincolnshire. I think that has diminished a bit during COVID, but we want to re-establish that, and we want the provider to re-establish that. That's a really important facet to patient transport. Okay, that's great, Tim. So we've actually got Kev who's put the eligibility criteria in, and also there was a question I think from Clive from HW Links as well about how do non-emergency transport operate, and there's also a link there. I was just going to check to see if there was any other questions. Right, yeah, here. We've got a comment about renal patient contract. Is this going to be a separate contract from the non-emergency patient transport? Our thinking at the moment is no, it won't be separate. So at the moment, the service that supports the satellite units in Boston, Skegness and Grantham is different to the overall patient transport service that we've got. We want to draw that together and put it all to the same provider to start with. However, it may be that that provider decides that they'll use some of the transport that is currently used by the companies who support those units. So technically, there is a company called RSL, Renal Services Limited, and they provide the dialysis at the satellite units, and they actually contract the patient transport provider for those units. It will probably be that the new provider uses the same transport providers for those units, but I don't know, that's for the provider to decide. But I expect, they'll work on the basis if it ain't broke, don't fix it. And we really do recognise that for renal patients, that relationship with the transport provider and that relationship with the drivers on a day-by-day, week-by-week basis is really important. So where we can, we want to encourage that.
Yes, there's quite a few comments in the chat around the voluntary driving services and who's available to do that. Yeah. So am I right in assuming all those connections are being made, Tim, with the new in the new specification?
They will be, definitely, yes.
Okay, so that people can be assured about that. Let me just look to see if there's anything else in the chat that we haven't discussed. Okay, there's one here, Tim. I think you may have answered this, but about taxis again. That's okay for some people, but what about those that can't get in a taxi? You know, so is that how the service will link to make sure those that can use a taxi can, and those that can't get a different level of transport?
That's the way it should work at the moment. So the transport provider has a number of what we call saloon cars that they use. What they do when a call is booked, when a journey is booked, they'll assess whether a saloon car is appropriate, whether a vehicle that can accommodate a wheelchair is appropriate, or whether a vehicle that can accommodate a stretcher is appropriate. So we're always looking at the needs of the particular patient for the particular journey. So yes, fully understand that there may be a concern that not every patient can get in a taxi. Yeah, fully understand that. What I wasn't saying that taxis are the only solution. There will be a number of other vehicles that are used to get patients home and to get patients to hospitals. So what we're not saying is that patients who need a wheelchair access vehicle or patients who need a stretcher. We're not saying that won't happen at all. So if I misled there, I apologise.
No, I think it was just
the only solution.
That clarification really in terms of that. So I think we've actually had some great questions this afternoon, both before the meeting and also in the chat. We have tried to get through the majority of those in the time that we've had available. As I said earlier, if people feel that we haven't been able to answer all of those, then please let us know, and we will get the response from the clinical commissioning group so that you can have your question answered. And as Tim said, it's really valuable, the information that you're providing, because it is help in shape the service, because we all want the best service for our population in Lincolnshire. Tim, I don't know whether you've got any final comments, because we're getting
just want to thank everybody for their, just want to thank everybody for their participation this afternoon. Your views will be taken into account. We really want to gather views from patients, from healthcare practitioners, and we want to use that genuinely to inform how the service looks in the future. So we will share this feedback with the provider. We'll probably share this feedback with the current provider as well. So, you know, it's not just about the new service. This is about, are there things coming up here that we can learn for the current service? So yes, but yeah, you really thank people for their time this afternoon. And I hope that's been useful for people. As Liz says, if there are questions in the chat, we'll have a look at those and we will make sure there's a response to them.
Okay, Kev, anything?
Sorry, I was going to say, Kev, is there anything you want to add?
Yeah, I think, again, just to echo Tim's comments, to thank everybody for their input today. And sort of further down the line, we will sort of report back on this in terms of some of the feedback that we've received and how that has shaped the specification for the new service. So we're really kind of clear that there is evidence available that shows how the service has been influenced by everybody's input.
Thanks, Kev. Pauline, would you like to say anything?
Yeah, just to remember to everybody out there that Healthwatch is your watchdog. So we will keep Kev and Tim on their toes. So yeah, please keep feeding into us, because we want to deliver, we want to get this right for the population of Lincolnshire, and we want to deliver, you know, the good stories as well as, you know, the not so good, and get it right. So yeah, thank you.
Absolutely, yeah, Pauline, can't can't top that. It's absolutely keeping the voice of the users of the service right at the front of all this. So again, just to reiterate everybody's thanks for taking part. Thanks for voting on the weights, acceptable weights, your questions, and the questions in your chat. And as Tim said, it's not a closed position now. You know, if there's more information questions that you want to raise, you can do those through Healthwatch or directly, I guess, through the CCG as well. So I'll sign off there. I'll not kind of ramble on anymore, but I just really appreciate your time. Thank you so much. Bye, everybody.
Thank you.